Medical billing in America is broken. Millions of Americans are struggling with overwhelming medical debt, not because they lack insurance, but because the system is built to confuse and exploit them. Hospitals and insurers bury patients under hidden fees, vague medical codes, and unexpected charges. Even something as simple as a routine procedure can leave a family with thousands in out-of-pocket expenses they didn't see coming. This isn't just an inconvenience, it's a financial disaster. Medical debt is now one of the leading causes of bankruptcy, with over half of all personal bankruptcies in the U.S. tied to medical issues. The system is failing, and it's hurting everyday Americans. Medical bills are designed to be confusing. Most are full of complex codes and terms that the average person doesn't understand, making it impossible to know exactly what you're being charged for. Hospitals and insurers use this complexity to hide fees and inflated costs. People are often charged for services they never received or face unexpected fees they were never told about. Trying to make sense of a medical bill has become a nightmare for many families, forcing them to overpay just because they don't have the resources or knowledge to fight back. Even those with insurance are caught off guard. High deductibles and unclear coverage leave people thinking they're protected, only to find out later they're responsible for huge out-of-pocket expenses. The lack of transparency in medical billing benefits hospitals and insurance companies, not patients. The prices for medical procedures in America are unpredictable and inflated. One patient might pay a few $100s for a procedure, while another pays thousands at the same hospital. Hospitals and insurers negotiate prices in secret, leaving patients with no idea how much they'll owe until they receive the bill. There's no way to compare prices or make informed decisions about care. This puts patients in a vulnerable position, especially in emergencies when they can't shop around for affordable care. Out-of-network charges are another common problem. Patients often get surprise bills because a specialist or facility they didn't choose was out of their insurance network. These surprise bills leave patients with massive debts they never expected, all because of a system that hides costs and lacks transparency. The inflated, unpredictable costs of healthcare are leaving families across the country financially crippled. Medical debt is crushing millions of American families. Over half of insured Americans still have medical debt, despite thinking their insurance would protect them. High deductibles, copays, and out-of-pocket expenses add up quickly, leaving families with bills they can't afford. For many, medical debt means choosing between paying for healthcare and covering basic needs like housing and food. This debt doesn't go away easily. Some people take out loans or put medical bills on high-interest credit cards just to keep up. Others are forced to mortgage their homes. Medical debt is now a leading cause of bankruptcy in the U.S., and it's pushing families that were once financially stable into poverty. For many, medical debt also means delaying or avoiding further care, putting their health at even greater risk. No one should have to make the choice between their health and financial stability, but that's the reality for millions of Americans. Errors in medical bills are far too common and add to the financial burden. Studies show that about 80% of medical bills contain errors, from duplicate charges to services that were never performed. These mistakes can cost patients thousands of dollars, and correcting them is often a long, frustrating process. Patients are left to deal with hospital billing departments and insurance companies, fighting for months to get the mistakes fixed. Meanwhile, these incorrect bills are often sent to collections, damaging the patient's credit and adding more stress to an already overwhelming situation. The fact that errors are so common yet so hard to fix shows just how broken the system is. Hospitals and insurance companies rarely take responsibility for these mistakes, leaving the patient to fight for their financial well-being. The lack of oversight allows these billing errors to continue unchecked, with patients paying the price. Insurance companies are supposed to protect patients, but they often make the problem worse. High deductible plans mean that patients have to pay thousands of dollars out of pocket before their insurance kicks in, and even then, coverage is often far less than expected. Insurers deny claims or offer minimal coverage, leaving patients with huge bills. To make matters worse, there's almost no regulation around how hospitals and insurance companies set their prices. They operate with minimal oversight, and the system is designed to benefit them, not the patient. Prices are set without any transparency, so patients have no idea what they'll owe until the bill arrives. This lack of accountability allows insurers and hospitals to take advantage of people when they're most vulnerable. Without major changes, this broken system will continue to leave families in financial ruin. Americans deserve a healthcare system that doesn't bankrupt them. Medical billing in the U.S. is built on confusion, hidden fees, and inflated costs that are ruining lives. Hospitals, insurance companies, and pharmaceutical companies are prioritizing profits over patients. But we have the power to change this system. It starts with demanding transparency, fairness, and accountability in medical billing. Speak out. Share your stories. Advocate for reforms that protect patients from unfair billing practices. Call your representatives and push for laws that hold hospitals and insurance companies accountable. Together, we can build a system that prioritizes people's health over corporate profits. It's time for change, and it starts with us.